Hello, my name is Dr. Elia Abi-Jaoude. I'm a psychiatrist working at Sick Kids. Since 2009, I have been working in the area of Tourette syndrome. I think it's a fascinating condition and it's a very rewarding population to work with. I see primarily kids, and I would like to tell you that if you see a child who comes to your office with tics, do not be intimidated. This is, again, a very rewarding population to work with. There's a lot that can be done, often with very simple interventions that can make a big difference for the child and their family. For a lot of patients who come, their tics are mild to moderate, and the tics may not be a problem necessarily in and of themselves, but it's more the reactions to the tics that are more of an issue. And so education, reassurance, and support can go a very long way. We know that most kids, their tics tend to peak around early puberty, and then most kids, not all, but about 80%, will gradually outgrow their tics over the course of adolescence. So just even having this message can be very reassuring to patients and families, telling families to not draw any attention to the tics, to ignore them as if they're not happening, and the same message should be extended to the schools, teachers, peers, and such. I would also recommend connecting them to Tourette Canada. The website is very simple, tourette.ca. The American version of is also a good resource, tourette.org. Both these websites are a wealth of information for families, patients, for clinicians, for educators. So there are a lot of good things that you can learn from that. If the tics are more problematic and warrant more targeted intervention, there are some options. You can learn more about these on this website. I would tell you that the first line treatment would be a behavioral therapy specifically for tics, and that is available in some places. And then it's only if, despite that, the tics are very significant and are causing problems, that then we proceed to other more invasive interventions. If needed, you can refer them to a specialized center. We are fortunate that in Toronto we have two such specialized centers. One is at Sick Kids, and we have a provincial mandate, so we are able to provide support, the care of anyone in Ontario, and then the other place is at the Toronto Western Hospital.